Hey, namaste. Going to do a few minutes of yoga therapy for bad backs. Okay. Notice how I'm sitting. Especially you older gentlemen, if you're watching this. If you can't sit like this, I'd love you to try. This is a basic stretch for bad backs. Interesting, isn't it? Just sitting like this. Now, some of you won't be able to do this. So I recommend a few different suggestions. Lean up against a wall and do one leg out at a time. So your back and your pelvis are connected, yes? Your back and your pelvis and your spine are all connected. Makes sense to get the pelvis supple. So this is the right hip getting more supple, left hip more supple. This is my broken hip. I broke this 12 weeks ago. It's okay. Slowly, slowly. Okay, so this is your first task. Learn to cross your legs. No pain though. Yoga therapy is about never allowing the body to hurt. The body, when it's in trouble, it sends a message to the brain. Pain. That's the trouble. That's the amber signal. What we tend to do is go to the doctor, say, doctor, give me a pill to take away the pain. He gives us Panadol or something equally horrendous as a preventative, and 30 years later we get cancer. The pain never went. Basically all that happened was the brain stopped receiving the message. The pain remained. The problem remained. The doctor's Band-Aid tablet didn't heal the body. So please don't eliminate pain. The way I eliminate pain is by resting and meditating and putting loads of magnesium in my mouth and on my body. That's another video. So, sitting like this, okay? Okay. Then we're going to transition into cat-dog. My hands are flat. My hands look like starfish. And we're simply going to go very slowly. We're going to breathe in and hunch. Let's stay here for 10 seconds. And because it's yoga therapy, look, it's cat therapy now. Because we're doing yoga therapy, we can change up the rules. Do what feels good. My body likes rocking. So I'm hunching gently for about 10 seconds, gently breathing, keeping it easy. Hello, Coco. Hello, Bitty Boo. And now I'm going to go back into the first position, or the other position, the neutral position. And now I'm going to arch the back. Now, because I have had spinal injury since I was 14, which is why I became a yoga teacher in the first place, you'll notice my back doesn't arch, okay? They want to diffuse my spine. Oh, I said, get away from me with those knives. So my spine doesn't arch, but it feels like it's arching. It feels fine. I won't overdo it. I won't ever force it. Ballet did damage my pelvis and my lower back a lot. Long-term yoga and Pilates, I've been a Pilates instructor since 2005, so that's 12 years. They have healed my spine. Although I'm still on the floor for 10 hours a day, recovering from the first few hours of the day. It's not easy for me. Yoga's kept me out of a wheelchair. Notice how long I'm here. See, I haven't transitioned to the next pose yet. There's no hurry. Now I will go to the next pose. And we're going to hunch again. Stay here for 10 seconds to 60 seconds, as long as you like. 5 minutes if you like, if it feels good. A variation on this posture would be elbows and knees apart and just rocking. So we're hunching, rocking around. Do what feels good. And if you don't feel good, don't do it. It doesn't feel good, don't do it. Again, we're going to transition into the arch, arching the back. And I like to go down here. Oh, that feels great. Oh, it's nice. Okay. Now, if you've got sore knees, you won't want to do this next bit. I'm a good example at the minute because I've just had my hip done, and my thigh done, and this is 12 weeks later and I can just kneel. Some people can't kneel. Why can I just kneel now? Okay, I'm going to go grab a pillow, excuse me. I'm going to demonstrate how I got to the kneeling position. Here I am. Okay, I use props. I use so many props. Okay, this is from Kmart. Notice how, that's actually not very comfortable up your bum. That is, but that's not high enough. A couple of these for the last few weeks has allowed the knee and the quad and the thigh or area to surrender into kneeling easily. So if you can't kneel comfortably, do this. And if this is painful altogether, you've got work to do. This is basically really important. If you can't kneel comfortably, your ankles and your knees and your pelvis are at risk. So if you want to live a vital older age, you better learn to kneel and you better learn to cross your legs. That's basic yoga therapy, guys. I hope this was useful. Namaste. Have a great day. Bye for now.